Well, we'll go ahead and get started. Thank you so much for joining us this morning. Based on the interest in this webinar, it's a topic a lot of you are interested in and wanting to know more about. And so we have gathered this morning our two experts on our continuing care agreement and our Lifecare Promise. So we're going to get started here. My two colleagues and two gentlemen I consider as my friends as well, David Tiesinga and Adam Kinder, are going to do a presentation. There will be an opportunity for question and answer. So along the way, if you have questions, if you would type that into the Q&A box, not into the chat, but into the Q&A, that way we all can see it, that are the panelists here, and we'll do our best to, excuse me, to get it to answer them at the end. But I'm joined by the sales team, Victoria Carson and Cindy Price here at Bretton Woods, and Kathy Revel at our Raybrook campus. So we're welcome, and we will follow up. If you have questions about it, we'd love to hear those. And more importantly, if you have an idea on a topic that you've been really wanting us to talk about and address, we would love to hear from you. So let us know if you've got some desire to understand or have us highlight something. But with that being said, I'm very happy to welcome David Tiesinga, the Chief Strategy Officer for Holland Home. I keep struggling to say that title because he's been CFO for 30 years, so we're still getting used to his new title. And you'll see his bio there. Certainly, he's been all over Holland Home. He's been here 35 years, and we're really happy he could take the time to be with us this morning, along with Adam Kinder, who's been with Holland Home 5 years, and he is our new Chief Financial Officer, graduate of Calvin, and he was the former CFO of Agility Health. So without further ado, I'm going to turn it over to them, and we'll let you guys take it from here.
All right, thank you, Michael, and welcome to the webinar. I'm not going to pretend that anybody knows anything about Holland Home, so I'm going to give a little 101 on Holland Home. So in front of you, you have an organizational chart of Christian Living Services. So Holland Home is actually owned by a holding company called Christian Living Services, and Holland Home's along the left-hand side of this page. We have our Bretton campus, our Bretton Woods campus, our Raybrook campus, Fulton, which we're currently in the process of selling, and then we have our foundation, which is there to support charity care within the resident population of Holland Home. Then we're also associated with Faith Hospice and Reliance, which provides waiver services, and Trillium Institute. Those are wholly owned 100% by Christian Living Services. And then we have partnerships with Care Resources, which is a local PACE program, Tandem 365, which does population health management, and they actually work under contract with Priority Health and Blue Cross. And then Atria Home Care, which has 2 certified home health agencies to support the West Michigan population, one in Grand Rapids here and one located in Holland along the lakeshore, and then the private duty agency Help at Home. So that's everything that when we talk about Holland Home is at your disposal for services. Holland Home is actually the 69th largest nonprofit multi-senior living facility in the nation. We've been around for 129 years. We were founded back in 1892. So I think that's one thing to keep in mind. Our plan is to be here for a while, and we've been here for 129 years already. Located pretty much in the Grand Rapids area. We have 3 communities that are active today: the Bretton Woods campus, the Raybrook campus, and in Trillium Woods, where Faith Hospice has their inpatient hospice unit. 2 of those facilities are life plan communities. We do have a debt rating by Fitch, which is a BBB minus, which is an investment grade rating. The interesting part of that is there may be 4,000 senior living communities across the United States. There's only about 170 of them that have a rating, and we have an investment grade rating with that. You can see in the chart there the size and of the organization. We have 1,196 different available apartments and settings for care. And that'll actually bump up to 1,211 here in June when we open our third adult foster care unit on the Breton campus. So as far as facility-based and community-based services, we offer independent living, assisted living, memory care, rehab, skilled nursing on both our Raybrook and Breton campuses. And in inpatient hospice services are out at the hospice unit at Trillium Woods. Community-based services can be provided both for folks who are living in the community or in our facilities. So Atria Home Care, Faith Hospice. Care Resources provides services to people who are living at home, who are on Medicaid and meet eligibility for nursing home care but want to stay at home. It's a nice program that we have in a partnership with a few others. Waiver program that's provided by Reliance, and I've talked about Tandem 365, which helps kind of navigate health systems and helps you manage them through those. So we're going to talk a little bit about continuing care and what that means. So there's actually an act, a law called the Continuing Care Community Disclosure Act. And the act was from 2014. It actually became effective April 2 of 2015. And it replaced the prior act, which was the Living Care Disclosure Act, which was enacted back in 1976. And really what this law does is it is there to give the state of Michigan Corporation Securities Bureau the power to really prohibit fraudulent practices and to impose penalties if they find those as it relates to life care agreements. So every year we go through a process where we actually register and really file almost a securities filing with the Corporation Securities Bureau who oversees this. There's actually 32 registered facilities in the state of Michigan. 29 of those are facility-based, 3 are really home-based. Some of these continuing care retirement committees or life plan committees were providing care long before the act was put in place back in 1976. And of all those facilities, there's almost 11,000 different units spread between independent living, assisted living, and skilled nursing. Holland Home has about 11% of those units at 1,196. You may be wondering who are these 29 facilities. So I've listed them there. Holland Home, incidentally, was the first registered facility in the state of Michigan. You can see our registration number is 10,000, or it's actually 0. It's the first one there. And you get an idea of the size of each of the units. Grand Rapids area, West Michigan area, really has a lot of life plan communities around, which is great. That means the population seems to be well educated about this, but there's 6 different facilities within Grand Rapids, and then we have some in Jenison and Holland and a few down in Kalamazoo, and then the rest tend to be on the east side of the state there. It's important that if you're not on this list, you're not registered as a life plan community, which means that you don't offer it. You're probably just a rental month-to-month situation, which is an alternative for you. So every prospective resident, and we're hopeful that everybody's on this call is a prospective resident that wants to know something about how a life plan community works, should be provided a disclosure statement. And you get this well in advance of making any decisions. It's like a prospectus if you were to buy a mutual fund investment. It basically goes through and talks about all of the contractual obligations of both the provider and the resident. The key to this is you should get this disclosure long before making the decision of whether you want to actually enter into an agreement. So what's in this disclosure statement? Well, there's a few things that are required under the Act. And one is to let you know that the continuing care agreement or life lease involves a high level of risk. And risk is really defined as cost. There ends up being entrance fees that are paid. And so that's a cost to you. So the state wants to make sure you understand that there's a high degree of risk. They're also suggesting that you should seek advice really outside of the life plan community to really review these agreements. While they're all based on a certain law that's out there, there are some different nuances with them. So they're really saying seek advice from an attorney or financial advisor, talk to your family members or people that you can seek counsel from that aren't necessarily with the facility. Know that that entrance fee that you pay with any life plan community is subordinate to the any mortgages that the facility had. And that's part of that risk that you take on. And then know that through your discussions, and we have very capable, qualified sales team, sales consultants that you're working with, no person is really authorized to make any promises other than those that are actually written within the disclosure statement. So if you hear something from a discussion with somebody that's not consistent with what's in the disclosure statement, the disclosure statement is what is true and factual. And so just understand that that's how that works. We're going to talk a little bit about the continuing care agreements. We're going to review kind of our entrance fee programs, talk a little bit about some of the monthly costs that are associated with us on this webinar today. So the continuing care agreement, really, when you break all of this information down and just think about the basics, there's really two things that it provides. There's a lot of information in there. It can be overwhelming as you look at all of the data, but when you break it all the way down, it's really two things that are the most important. One is that it provides access to our nursing facilities or other levels of care on a basis of priority of somebody who doesn't have a contract. So in other words, if you have a continuing care agreement with Holland and you're living in one of our independent living areas, you have access to our nursing centers or our assisted living facilities based on somebody who doesn't have an agreement. And we make sure that you have that availability for you when you need it. And then in addition to that, if for some reason you're in those levels of care, higher levels of care, and they get expensive, there's no question in my mind that it's very expensive to be in assisted living or nursing today. If for some reason you exhaust all of your ability to pay for those services, we have a process to review that and determine whether or not we can provide some discounted fees to you through our benevolent and charity program and allow you to continue living here, getting the care that you need at an amount that you can afford to pay based on the resources that you have. And so those are really the two basic provisions of what the continuing care agreement provides. So why is access to Holland Home important? And this is really a key. First of all, our Holland Home nursing facilities, both of them, the Bretton Woods and the Rayburg campus, are 5-star rated quality facilities. Now, nobody goes into a senior living community thinking about the healthcare component. You're going to look at different campuses. You're going to look at the beautiful different options you have on apartments or homes, and it's like moving into a new place to live. Oftentimes, the last thing in your mind is the healthcare component. We don't want to think about it. We never see a line at the front door of a nursing facility with people waiting to get in. We don't desire that. That's something that we don't really think about. But just know that in Holland Home System, if you need those services, they're second to none. Both our facilities are 5-star rated. Both facilities are on U.S. News Report's best facilities in the nation. And a lot of it has to do with our desire for excellence. And a lot of that goes back to staffing levels. And you see this little grid on this page. And in Holland Home nursing facilities this year, in our budgeted plan of how we're going to run them, we budget them at 4.1 hours per resident day. And you see a bunch of other statistics about typically what you see in for-profit nursing facilities, some other nonprofit facilities. Even if you look at the bottom of this page, state of Michigan last reported the average is 3.5 and Kent County is 3.6. So fortunately in the West Michigan area, we've got some very good nursing facilities. But again, we think it's very important to provide the highest level of care we possibly can. And that's important. If you don't live in a Holland Home facility and you want to get into our nursing, it's possible. It's possible that it could happen, but it's not guaranteed to you through a contract. You may end up in a different facility that doesn't provide the high level of quality services and staffing that we do. So certainly key and point in all of this is access to our facilities. Another reason is about 75% of our nursing rooms are private rooms, and really we're on a plan to move to 100%. It's just taking a while for us to get to that point in time. All of our assisted living rooms are 100% private rooms, and all of our memory care assisted living, 100% of those rooms are private rooms. Holland Home was also the first facility in Michigan to receive the designated organization from TIPA Snow under the positive approach to care, which is a really high level of designation for dementia care. And 100% of our staff, including myself, Adam, Michael, everybody in the sales team, everybody in our facilities, housekeeping, dietary, our administrative teams, and those providing care, all go through the dementia journey training for staff. It's how do we handle people dealing with dementia and memory care issues. And we've made a total commitment to being able to provide the best care possible for those dealing with dementia. So certainly a reason to have access to Holland Home. I'm going to give you a little demographic story here. If you think about the aging population of the United States, there's a little box there that's highlighted for the 80 plus category. Now, many of you are probably younger than 80 or maybe approaching 80, but in the year 2020, there were 13 million people in the United States that were 80 plus. By the year 2040, that number will be up 113% to 28 million. That's a huge increase. And if you look at the cohort or the age group of 65 to 79, just below that, that's up another 10 million. So as the population in this 20-year time period goes up by 41 million, 25 million of that is for really retirees, those who are older. That's just an amazing graph of demographics. So I think it's important to align yourself, if you're thinking about getting into senior living, with a community that provides this broad level of services, no matter where I am, and has really a commitment to excellent quality services. And the reverse side of this is really what's on the next page. It really talks about caregiver support. Today, there's about 6.3 people in the age group of 45 to 64 that are really caregivers, compared to every person that's over 80. Over the next 20 years, 2020 to 2040, that number really gets cut in half. So as you think about options, hey, do I really want to move into a senior living community, or do I want to just live in my home or a condo? I think one of the things that I think about is if I need some sort of service, whether it's long-term or whether it's episodic, is over time, can I even get access to somebody to actually provide that care to me? And I think that's going to be a real challenge going forward as we look over the next 10 to 20 years here, that this is going to be a challenge that any one of us have at this point in time. And then I think if you think of your kids, oftentimes your kids are working and may not be able to provide that care for you. So I think that's just a big challenge going forward. But I want to talk about one other thing too, as it relates to this too. The number of people that work for Holland Home, we do not use outside agencies. So I think if you're comparing us to others in the area, just recognize that Holland Home has its own staffing agency. We're committed to providing care for people who work for Holland Home, not really employing a staffing agency to get staff for to provide care. And I think as it relates to caregiver support, we have made a huge commitment not to use outside agency staff. We want to be able to provide care with people who are committed to our mission and not use outside agency. So now I'm going to turn it over to Adam to talk a little bit about entrance fees.
Great, thanks, Dave. A few things as we talk about entrance fees here before I get into kind of our three different plans here. But so in every single one of our entrance fee plans for independent living, it basically has two components. So that's how we should think about it. There's a non-refundable component and there's a refundable component. And Dave later on will get into that. So we have three basic entrance fee plans available, and each one is going to vary the percentage that's the non-refundable and the refundable piece. So in each case, we have a 35-65, where 35% of the entrance fee is non-refundable and 65% refundable. We have a 50-50, which is just as it sounds, and we call it a 75-25, where 75% of the 75% of the entrance fee is non-refundable and 25% is refundable. And each of these actually has a different net entrance fee for the individual unit. So think of it this way: the higher the percentage of the non-refundable, the lower the entrance fee. So, and really it's all towards designing opportunities to get into our communities that are as affordable as possible. And so this is where, as we talk through some of these different entrance fee plans, this is where we encourage people to really work through the financial exercise with their advisors, anyone that they consult with that they would trust. We're obviously here to help provide guidance and walk people through kind of selecting what entrance fee plan might make the most sense for them once they've kind of decided on a unit type that they really like. So here's a couple of examples just to highlight a little bit of specificity of what I'm talking about. So an example here at the Terrace, which is a Bayberry, one bedroom, about 960 square feet. So in the 75-25 plan, you see the overall entrance fee is $154,000. So the non-refundable in that case would be $115,000. The refundable would be about $38,000. So the other way to think about this too is that the non-refundable also essentially represents your cost. The refundable is something you'll get back once you vacate the independent living unit. So as we talk through these, think about the number immediately to the left in the brackets is essentially the cost in this case. So in the 50-50 plan for that Bayberry, $181,000 entrance fee, the non-refundable is $90,500. The refundable is $90,500. In the 35-65 for that same unit, the entrance fee is much higher, $201,000. The non-refundable piece, the overall net cost to you, is much lower at about $70,000. So the refundable piece is about $131,000. So that's where we design these plans so you can see how somebody could stretch to get into a Bayberry if they needed to at the 75-25 level, or they could play with some some finances on their side to say, well, maybe I want to do the 3565. Maybe I want my non-refundable to be as low as possible, my refundable to be as high as possible. It really comes down to what makes sense for you financially, and what might it take for you to get into that specific independent living unit. So we can flip to the next here. So Homes North, really there's one kind of nuance here, and that's Breton Homes North, where instead of a 75-25 plan, we have an 85-15, because Breton Homes North is a new development. And these are all being kind of, as people sign the CCAs, this is how they're being constructed. We couldn't get the economics to work at a 75-25 on initial construction. So, but the 85-15 works very comparably to kind of how all the other plans would work from an overall mechanical perspective. So we want to go to the next one. Entrance fee ranges. One thing I really want to note here is if you look at the Raybrook campus, our lowest cost unit would be a 75-25 entrance fee plan. And that would be in Estates to Electra, which is about 600 square feet, about $75,000 is the overall entrance fee in that case. The highest cost on the Raybrook campus would be a 35-65 plan, and that would be a Cygnus, which is just under 1,800 square feet, $360,000 entrance fee. Bretton Woods campus, our lowest cost would be a 75-25 plan, which is an Aspen at about 120,000. It would be the entrance fee, and then our highest cost is one of the Breton Homes North units, which is a Laurel at 2,700 square feet on the 85-15 plan, which is about $760,000 entrance fee. The one thing I really want to note here, though, is it's not like we just have one of each of these on our campuses. So the Electra example, there's 8 of those on our Raybrook campus. The Aspen example, there's 19 of those on our Breton campus. If you look across our whole kind of portfolio of our independent living units, when I looked at it, we have about 35% of our total unit portfolio as an entrance fee cost of $175,000 or below, potentially. So when we talk about affordability, we try and be very serious and intentional about this. We want to always look for opportunities for people to get in. One of the other things to note too is as part of the kind of admissions process, as you're looking to figure out what makes sense, we do require a financial disclosure. The financial disclosure isn't intended to be an exclusionary tool. It's intended to be as inclusionary as possible. It's to say, okay, help us understand where you're at. Help us make sure that you're finding yourself into the right entrance fee plan. We want to be able to get to a yes, but we don't want somebody who has very little in assets, very little in income to say, yeah, I want the Breton Homes North Laurel, at $760,000, and they just ate up all their assets. We want to make sure you're getting into kind of the right type of unit for you and to help guide you. We don't even want to show you if you can't potentially afford a unit. We don't even want to necessarily show that to you, but we use the disclosure really to help guide folks into getting to yes. We very rarely get a disclosure in which we say no. There's absolutely no way you'd be able to fit financially into any of our available plans. We really try and get as creative as possible. So when you get asked for that financial disclosure, know that it's not intentionally to try and exclude somebody from the community. It's just to make sure that you're fitting into the right unit type and entrance fee for you, kind of thing. We do, that's to say, on occasion we have said, yeah, we're really going to struggle to fit you into a specific unit, but we always try and get to yes. A couple other things. Entrance fees can be adjusted depending on kind of the add-ons that may be available in a specific unit. So really, most of these features are typically available in the Raybrook homes and the Breton homes, and those could be completed lower levels, porches, 3-season rooms, fireplaces. Well, there could be an elevator in there, generator add-ons, those kinds of things, and those may impact the overall entrance fee you may pay. Those could be added on to if they're not already in the unit. Those could be opportunities for you to potentially upgrade the space, which would come at an additional cost to you as well. Second person fee. So when we talk about the second person fee, there's really two options from a second person fee perspective. There's the you can pay a one-time non-refundable of $30,000, or you can pay $350 per month, which you would pay until the second person is no longer permanently residing in the independent living unit. So really what it comes down to is that as you're looking to add a second person onto the CCA, so a couple, say think a married couple in this case, really this is about you having a conversation, sometimes a very honest conversation with each other to say what makes sense. It could be contingent on whether you're asset rich or income rich. So if you're asset rich, maybe paying the $30,000 makes more sense than paying the $350 per month. If you're income rich, maybe paying the $350 per month versus the $30,000 one time, it makes more sense. The other element here is kind of having that honest conversation, and maybe one spouse, you're relatively certain they may need a higher level of care sooner rather than later. Well, maybe it makes more sense then to pay $350 per month in that case, because maybe odds are that spouse may be moving into assisted living in the next 3 to 5 years. And in that case, financially, it probably makes more sense to do the $350 per month versus the $30,000 up front. Or you could say, hey, we're both in great shape. We're going to do the $30,000 per month, not the $30,000 one time. So this is just another element to have that honest conversation. And again, the sales team is there to help facilitate some of that conversation too, because it's new for you trying to work through this, and they've seen it play out hundreds of times. And so there's a resource for you as you walk through each of these specific decision points.
Okay, I'll take over here again. The non-refundable amount, Adam referred to that as a cost. So, whenever I look at buying something, the money I don't have after I've paid it is my cost. That's what that non-refundable amount is. Now, that non-refundable is used over at 1.5% per month. So if you paid an entrance fee, and after 1 year, you left Holland home, you passed away, you moved closer to the kids that were someplace else, the non-refundable, even though it says it's non-refundable, is refundable. It's used up at 1.5% a month. So after 1 year, roughly 18% of it is used up. That means the balance of that, the 82% that's left, would be refunded. So it's important to realize that non-refundable is amortized at 1.5% per month. Another part of the non-refundable is it's considered a prepayment of future care. So what you're doing is it's not paid in a monthly amount, you're paying it up front, but it's a prepayment of future care. It may be deductible as a medical expense in the year that you paid it. And that's important to realize. Holland Home uses that money over your life expectancy within our organization. And because we account for it that way, it may be used as a medical expense. So the IRS says you should do an actuarial study to determine what that percentage is, but that's not really feasible for an individual or a couple to do. And so the IRS has said you can actually use the percentage method for figuring that out. So when you come in, there's some information that we provide to you that we've received from Plant Moran, our auditing firm that did some research that found most of the data that's out there related to deductibility, and you can review that with your tax person, your CPA, to figure out what that is. But typically, our medical expenses run about 50% in a year. So if you had a $200,000 entrance fee under the 50/50 plan, and 100,000 of that's non-refundable, about 50% of that, or 50,000, could be deductible in the year that you paid as a medical expense. So realize that that's a big deduction, $50,000 that you're offsetting income in that particular year That's another important reason why you need to talk with your financial advisors about what might be better for you. Because then if you go back and look at those different plans, maybe you want to maximize what that non-refundable amount is because of the medical deduction. Maybe you don't. So it's something to kind of keep in mind. Compare contracts between life plan communities. So Holland Home takes the non-refundable amount and we amortize that at 1.5% a month. So that means after 67 months, it's fully amortized, it's fully used up. There are some life plan communities that amortize 100% of the entrance fee at 1.5% up to the refundable amount, which means that it's used up twice as fast. So you're burning through more of the refundability of the non-refundable faster than what you realize. Most people probably aren't looking at the details to even pick that out. But if you're looking at comparing Holland Home to others, we know that there are others in the Grand Rapids community that do this, and it's costing you twice as much. It's used up at a faster period of time. Now, if you end up living someplace longer than 60-70 months, it really doesn't matter at this point in time. But if you're dealing with some life expectancy challenges, and that's why you're moving into senior living, this may be something that you want to take a look at as far as how that works. The refundable amount, so not the non-refundable, the refundable amount, that is refunded back to the resident, at the time that you move into you vacate the apartment or the home and you move into a higher level of care, or you terminate your continuing care agreement and move outside of Holland Home, or you've passed away. So you vacate the unit and then it's either moving into higher levels of care, you pass away, or you terminate the agreement, move someplace else. So when is that refunded back to you? Well, for all of our units, with the exception of Bretton Homes North, it's within 9 months, or at the time we place another resident in occupancy of that unit that you vacated. Bretton Homes North, it's actually 18 months. Those are higher entrance fees. They take a little bit longer to sell. So it's 550 days. Those refundable amounts are reduced by a sales charge of 6%. State of Michigan, under the rules, says that you can charge up to 8%. So that's, again, look at the contracts. If you're comparing us to others, those percentages are all over the map, but it can't be higher than 8%. And then refurbished costs equal to greater of 4% of the entrance fee or actual. And that comes right out of the state law. That's something we don't really control. We're just following the state law with that to charge it that way. And then another thing to keep comparing to, if you're looking at other places, is that the new Continuing Care Disclosure Act that went in place in 2015 allows you to set the date of the refundable amount to the up to the time that you actually resell the unit. So, and it's not date specific like our contracts are at nine months. So it could be at resale. So understand those agreements when you look at them. It could be a much longer period of time if we run into a situation where the real estate market's not real well and people are not coming in. It could be a long time. If you're subjecting yourself to the facility reselling that unit, it could be years. And so make sure you review the contracts as it relates to that provision. Adam.
Great. So a few more things to note as we walk through a couple other elements of the CCA. We'll talk about, right of occupancy, adding a spouse to an agreement, ownership of the unit, access to licensed facilities, and options for payment of the refundable. So let's talk about right of occupancy. So occupancy is quite simply, it's a limit to the person or persons named in the agreement as the member. That's ultimately who is available to occupy the living unit.
And I'll talk about marriage. So oftentimes you'll come in as a couple, and or you may come in as a single, and all of a sudden you're living in a place where there's other singles at your age, and you may decide, well, you know, I'm gonna get married. That happens a couple times a year, it seems like, here at Holland Home. So you can actually add a person, a spouse, to your agreement. By adding them, you can only do that kind of one time. So if you come in as a couple, your spouse passes away, and you're widowed for a year or so, and you meet somebody else, and you want to get married, and you can certainly do that by adding that person as a spouse to your contract. Whenever that happens, just understand that when you add a second person to the agreement, that spouse becomes a member, becomes a life plan member, and for all purposes is responsible for all the rights and responsibilities and obligations under the agreement. And even if you're a couple looking at coming into Holland Home for the first time, and maybe you're already in a second marriage, just understand that when both parties of a second or third marriage join, there may be a prenup agreement that's out there. Holland Home is not a party to those prenuptial agreements. And so understand, when both parties sign an agreement, you're both on the hook for all of the expenses for both members of the couple for as long as they live at Holland Home. And so we'd be happy to walk through that if you have a particular situation. But we've run into this situation in the past where, you know, her stuff was her stuff, his stuff with his stuff, and they were going to each keep it separate. But when you both sign the agreement, you're signing the agreement as a couple, and both responsible for the costs associated with that going forward.
Ownership. So there's really two things to note regarding ownership of the living unit. So Holland Home, in all cases, retains ownership of the living unit. The continuing care agreement doesn't grant a change in title of any of the real estate in connection with the execution of the CCA. So really, this is about the continuing care agreement. It's not about real estate. So access to licensed facilities at Holland Home. This is really key. This goes back all the way to the beginning when we started talking, when Dave kind of noted how the demographics continue to shift, and access to licensed facilities, whether assisted living or skilled nursing, may become harder to come by as we move through the next decade or two. As supply will likely not necessarily keep up with demand for those services. So the continuing care agreement ultimately grants you access to Holland Home's licensed facilities. So you come to a scenario in which one spouse notices that the other one is struggling a little bit more with activities of daily living. The one spouse is more challenged in maintaining that primary caregiver role, and it may start to make sense to have that struggling spouse assessed from an activities of daily living perspective. Well, we have a very objective level of care assessment where we'll come in, do an assessment, understand where the ailing spouse may be at from an activities of daily living perspective, and then that'll serve as a basis to have some honest conversations about whether it makes sense for that individual to then move to a higher level of care. So be that assisted living, or in some cases even bypass assisted living and maybe go to skilled nursing based on severe deterioration. So that's to say that we maintain this objective tool. Kind of the beauty of Holland Home is that we are there to walk alongside you as these life changes occur, and that's really what we're incredibly good at. And we have incredibly skilled staff to help walk you through what all of this means as your health conditions may change and as you move through kind of our continuum into higher levels of care. The other thing to note is, as you move through those higher levels of care, you're not required to pay an additional entrance fee. So if you're in independent living, you paid your entrance fee assigned associated with your continuing care agreement. As you move into assisted living or skilled nursing, you're not having to pay another entrance fee to get into those facilities. You are required to pay, the fees associated with the services you're receiving. So, you'd move into a scenario in assisted living where you wind up paying a daily rate for those services you're receiving. If you're still nursing, you pay a daily rate for those services, but there's no additional entrance fee in those cases. Options for returning the refundable, which Dave was previously discussing. Really, there's kind of two options. So if the resident is still living at the time the refund becomes payable, so you've left your independent living unit, it's been vacated, you're now in assisted living, we would make the refund out to you when the time comes to issue that refund. We pay it to you directly. If the resident vacates the unit via passing away, then when it comes time to issue the refund, it will be made out to the estate of, or otherwise made payable to the resident's trust. And we encourage all residents as much as is possible to explore getting a living trust if you don't have one, a revocable living trust. And then it helps satisfy a number of these kind of estate level settling situations once a refundable needs to be issued down the line.
Okay, let me talk about financial assistance. So we require that any resident pays whatever the established fees are for the service area that you're in. And most people have absolutely no problem with that living in independent living. It's typically when somebody moves into higher levels of care, memory care, assisted living, nursing, that those costs get to be pretty big, and it's possible that you may exhaust those fees. So we have a process for applying for financial assistance, and we evaluate each person's situation based on rules we have, but based on the individual situation of anybody that's asking for support on financial assistance. So we ask each member who's in that situation to re-up a new financial disclosure. It's very similar to the one Adam alluded to when you first come in. We want to basically confirm that you're in a position where when you're not able to pay those fees. We want to make sure that we can access any public support that's available to you, and help you with those applications when they're necessary, to advise you on where we're going. And if for some reason there isn't anything available, then we will come up with a plan for you that allows you to pay a discounted fee or a waived fee based on that particular situation. To the extent that we provide assistance, and there's still a refundable amount that's owed to you, we would deduct that eventually from the refundable amount, because that's an asset that you have, which would give you the ability to pay for those services. One thing is we're asking each member when they sign the agreement that they're not going to divest themselves of assets that may become necessary to pay for services. And we think that's only prudent when we go out and ask for support to our foundation, that we're not asking for support of people who have impoverished themselves on their own by giving away all their money. We also look at this threshold of about $5,000 a year. We know that we're not after tithers. We think tithing is very important in our lives, and so but we're not looking for people who are getting rid of their resources at the time that they need to pay for care. And so I think that's a big thing. So transfers on the bottom of this page, transfers to an irrevocable trust are considered a divestment from Holland Home. So there's a lot of good elder law attorneys out there, or ones that are out there that basically say, hey, take your assets and put them into this irrevocable trust. What you're basically doing is saying taking assets that I have that are available to pay for care and putting them someplace that I don't have to use them for that. And so we would deem that as divestment. We would not provide assistance in those situations, and we would have to work through those. So just know that we have those rules in place, as most life plan communities do.
Independent living costs. So a couple of things to note here. So our current monthly fee for the Brentwood campus is $725 a month. And the current monthly fee for the Raybrook campus is $728 a month. And then there's a cable TV component that's layered on top of that for both campuses. The thing to note when you look at monthly fees and you're comparing community to community is what's included in the fee. Our fee, we try and strip out a lot of the extras. So in other communities, you may be looking at the monthly fee, maybe $2,000 to $4,000 a month, and that includes a meal plan, housekeeping, all kinds of stuff. We've really erred towards the side of trying to keep our monthly fee as low as possible, and then there's add-ons available. So if you wanted to have housekeeping services, we have those available to you. You'd pay a la carte for those. If you want to go eat in our dining areas, great, you can go do that. You kind of pay per meal, that's a la carte as well. But it's all geared towards trying to drive our monthly fees as low as possible. So as you're looking and comparing to other communities, that's one thing to note. The other thing too is your monthly fee isn't dependent on which entrance fee you picked or what plan you picked. It's kind of everybody pays the same monthly fee. There are other communities where you may get into these scenarios where depending on what entrance fee you picked, your monthly fee is X and that kind of thing. That's not really how we've designed kind of our fee structure. It's kind of a one size fits all in this case, trying to drive it as low as possible. So again, affordability has always been this thing that we hold out intention to try and maintain an affordable structure for everybody. The other thing too, property taxes, those ultimately get passed through our facilities onto the residents. Those, as they get charged to our independent living, we push those out on an allocated basis. It's all spelled out in the disclosure statement. So it's a pretty standard approach. Assisted living fees, this is where if you have long-term care insurance, this is where it may start to kick in. So as you look at kind of our fees, as Dave alluded to, it's assisted living isn't a cheap area to receive care in, and neither is skilled nursing. You can see based on your level of care, and your level of care is really an indication of the volume of services that you're consuming, the volume of staff time that's required to assist you with activities of daily living. It ranges, at Raybrook anywhere from $82 to $270 a day. In the memory care areas, it's as low as $172 to $281 a day. So it can really fluctuate quite wildly based on what it is that you actually need to be receiving as far as services go. Brighton campus, this is just to highlight the monthly fees for assisted living there. It ranges really from $192 to $291 a day on the Brighton campus as well. Skilled nursing, a couple things to note here. Residents who are covered under a CCA pay $20 per day lower than somebody coming in from the community who hasn't already bought into Holland Home via a continuing care agreement. So again, these rates vary from $320 a day up to $390 a day, depending on the room, whether it's a semi-private or private room. So again, things to note as you're looking at other facilities as well is how does their monthly fee structure or how does their daily fee structure work as you move through the higher levels of care.
Yeah, I just add on the skilled nursing too. If you meet the Medicare requirements, then obviously our facilities are certified for that, and there's no charge for the Medicare certified days that are you're entitled to there.
Right. Yep.
All right.
Great.
Michael, we'll turn it back to you for Q&A.
Sure. Well, thank you, gents. That was a lot of great information. And I know we have some great questions. So I'm going to just dive right into those. in the interest of time. So the first one I want to ask is, someone asked, what's the process to continuing care? I want security if I've exhausted all my funds. I don't want to be surprised when I need it most. Who wants to take that?
I can do that. So when you sign a continuing care agreement for Holland Home, that is the process. Signing a continuing care agreement guarantees you access to our facilities. And if you've exhausted your resources, not through divestment, but exhausted them through just payment of services, we will continue providing services to you. We don't put you in a specialized unit because you don't have the ability to pay. And I can tell you today, we range anywhere from 1 out of 6 to 1 out of 7 of our residents are in that exact situation. That amounts to $3 to $5 million a year of waived fees that we have because somebody can't afford to pay. And really, it's the beauty of the Holland Home Promise is that if you come in and commit to the rules of paying for care for as long as you can, and when you run out, those services will be available for you at the same level they are if you were paying the full amount. And we'll do that for the rest of your life. And it's a beautiful thing that we can do that going forward. So that's how it works. You sign the agreement and commit to the payment schedules until you no longer can pay for those, and then it kicks in at that point in time.
Yeah, I just want to add from a process standpoint. To me, I love the question because it highlights kind of one of the most beautiful things that is Holland Home in a lot of ways. Because in that scenario, when you run out of resources, I've noted it as an example of it, maybe one of the most traumatic experiences of your life. And so we're there to be there for you in that moment to make it as painless as possible. And so, it's as simple as, noting to, one of the directors at a facility to say, hey, look, I'm running low on resources. We put you in contact with the person in the finance team. And then they start to have that coordinated conversation with you to understand where you're at. What does it look like? Okay, let's talk through what the monthly structure may need to be. And it's kept incredibly confidentially. So the staff that's serving you in a direct care capacity has no idea typically what your wherewithal to pay is for the most part. I mean, on very rare occasion, they might have an idea if somebody is in a particular scenario, but we take great caution to ensure that, those who are providing care really have no idea who may be on benevolence and who isn't.
Great. Thank you. And it was an excellent question. It goes to the heart of our whole presentation. So next question, why are taxes and overall costs higher at Breton versus Raybrook?
I can address that. Yeah. First of all, entrance fees are a little bit higher on the low end, and it really has to do with when those facilities were developed, and it goes back to a construction cost. The monthly fees are relatively the same. The property taxes are really what's higher, and it's really driven by a scenario that at one time independent living was not taxed. So when we first built Estates 1 back in the mid 80s, it wasn't taxed, and then the Grand Rapids City Assessor slapped an assessment on it. Holland Home actually fought all the way to the Michigan State Court of Appeals and lost, and taxes have remained. And the beauty, I guess, of the loss and when that happened was it was actually predated the Headley Amendment, which raised sales tax, but capped property taxes, your assessments at where they were, and only subject to CPI increases because of changes in ownership. So because the Raybrook campus has been around longer and they had lower assessments way back at the beginning, the taxes can really only go up by CPI. Breton, because it's a newer campus, those assessed amounts were actually put on subsequent to the Headley Amendment, and so we have higher assessed facilities that are there. And then if you look at the actual millage, so the taxes, property taxes, are really produced by two things. There's an assessed value, taxable value, and then there's a millage rate. The millage rate is a little bit higher in the city of Kentwood because they don't take income tax from folks at that point in time, and that's what really drives a higher rate. There's no add-on for property taxes, so it's a pass-through, and they're fully deductible as property taxes for income statement or income tax perspective. But that's why they're a little bit higher on the Breton campus.
Great. How long can a guest stay with us? Say my brother and his wife visit from Minnesota and they want to come see me for a week.
I think that's fine. We don't really have issues with that. I think obviously they don't have occupancy rights to live there as their place of residence. But if you have family that are coming to enjoy time visiting with you, I don't think there's any issues with a week stay or that sort of thing. If they get longer than those periods of time, obviously, then they should take advantage of guest apartments or hotels that are around and that type of thing. But I think those shorter stays of a week or so, I don't see any issues with that at all for accommodations, especially if you got room for them in some of the apartment sizes that we have.
Yeah.
We've gotten this question a couple times. What does it mean that entrance fees are subordinate to mortgages? We've got that question twice.
Yeah, that's a good question. I'm glad you're asking it. So Holland Home has debt. So we actually have public debt. They're through tax exempt bonds, and that debt is secured by a mortgage. So if there was ever a time that Holland Home was going under, the bondholders have a first position to the property. And the entrance fee, the refundable amount, which is an asset to you and a liability to Holland Home, is really secondary to those mortgages. So the key thing is people like me and Adam, who have been at the helm of the financials for the organization, are going to commit to you 100% effort, never to get to that position where it's ever an issue. And so Holland Home, I think you can rely on the fact that Fitch has said we're a BBB- rated organization, investment grade rated organization. We have the resources to continue in business. We're in much better financial standing today than we were 30 years ago. We have a continued financial plan to keep us solid financially, to be able to never be in that situation where a bondholder is looking for an issue where that would be problematic. But that's all it means. It just means that that entrance fee dollars are subordinate or in a second position to the first mortgages we have with debt.
So next question here, does the existence of long-term care insurance influence the cost of the continuing care agreement?
It really does not, but we're happy that you have it. So you don't get a discount to the agreement. Really what you've got is you've got an insurance plan in place that's there to protect you from spending assets, and really gives you an income source to cover long-term care at the point that you would qualify for that in assisted living area.
Does the monthly fee change in independent living with a second resident? I mean, you touched on that, but maybe just evidently
it does, to the extent that you've made that decision, right? So when you first move in, you have to make the decision. If you're a couple coming in, there's two occupants. There's going to be two occupants. You got to decide either you pay the $30,000 one-time entrance fee, or you pay $350 per month. At that point, then that $350 per month kind of attaches to that second person for as long as there's a second person in there. But there's no additional like second person fee beyond just what I laid out.
It's a good question though, because I think when you're comparing to a lot of other life plan communities, there are second person fees that can range anywhere from, $300 a month to $750 a month. And I think you see those generally in those life plan communities that probably have more an all-inclusive fee as opposed to an a la carte fee with us. So it's attached to meals and other services that are there. But basically, other than that entrance fee discussion, no, the charge is to the unit. So whether there's one person in that unit or two people in that unit, it's a standard fee.
Okay. This question, I think it's a question I could probably answer, less about finances. Sorry, gents. He asked the question, he's concerned about the restaurant hours being only from noon to 4:30. Any plans to extend hours at Breton? Absolutely. We're just coming out of COVID and everything is we're kind of emerging. So those hours are going to be expanded in very short order. So I don't think that's anything to worry about. Your other question, there's only one bus per week carrying 12 people to the grocery store. I'm concerned with 400 plus people on site that those 12 spots will be extremely coveted. That'll be all driven by, if 24 people wanted to go, we're going to get a second bus. So we've not filled the bus ever. A lot of people still drive and will go on their own. But I would say if we get more than 12 people want to go, we're going to add on a second bus. No problem. Keep in mind, we also have a market on site where you can get snacks, meals, cleaning supplies, snacks. Heavy on the snacks. I like that. So hopefully that answers your question. So let's see here. Hang on a second. My computer. Let's see. What is a Medicaid waiver? That came early in the presentation.
Yeah, so I talked about that as it related to one of our sister companies with Reliance. So it basically means that if you're living out in the community and you are eligible for nursing home care, but you don't want to move into a nursing home and you're eligible for Medicaid, you can work through an organization like Reliance to arrange for services to come into your home that are paid for by Medicaid through the Medicaid waiver program. It's an exceptionally good program. If you think about yourself as a state of Michigan resident, those programs save the state of Michigan a lot of money because they're far less expensive in providing Medicaid services to somebody who's living at home than to cover those services for them in a nursing facility. So Reliance Community Care Partners, which is a sister organization to Holland Home, provides Medicaid waiver services throughout 13 counties in West Michigan, and they do that for Adam, is that we up to about 1,000 people who are living at homes providing those
pretty
care?
Close to 1,000 now. Yeah.
And so, but that's what that is. It's a way for us to continue providing those services to people in the community that choose not to come into senior living and meet the requirements of Medicaid and nursing home eligibility.
Great, thank you. Question: are you vegan friendly?
Are we vegan friendly?
Yeah.
I'm friendly to vegans.
I think, yeah, our kitchen and our dining staff are very open to trying to meet the needs of residents' dietary, whether it's low sodium, if it is, vegetarian, vegan. We have done some. We've just had some that have that need, but I think it's all driven by what the need is. So, have we been vegan friendly without vegan residents? Probably not. But with a lot of it, like I answered the question earlier about the shuttle, a lot of this is driven by what are the residents' needs. So we now currently are self-operating with our dining program, and we used to contract with an outside firm. But now we are totally self-operational, and our quality has increased substantially from what I hear from residents, from my own experience eating there. So it's really, really good. So, so to answer your question, yes, we would work with you on your dietary needs. Average age of resident in independent living.
Yeah, so I think at move-in, it tends to be around 78 years old. It's a little bit younger than that for people who are moving into the homes as opposed to the larger buildings of the terrace and the ridge and estates 1 and 2. So basically, and that's an average. So, averages are kind of crazy numbers, and you're talking to a numbers guy. We have people in their late 60s moving in. We have people in their late 80s moving in, but on average, that's kind of where it is. So that's at move-in. If you think about that, the average length of time that people live in our independent living areas is about 11 years. And so we can't control that. Only our creator can. So if you think about the average age coming at age 78 and you're living 11 years, we have a lot of people who are in their 80s who are living it. So if you look at the average age of people who are living with us, it's probably the mid 80s. I would say 85 to 86 is probably the average of everybody who's living with us. And then obviously we have a lot of people, I think because of the vibrancy of our programming and things that are available through our Vibrant Living program, we have people actively living in independent living well into their 90s. So that's a tough question, but I think at entry, generally 78 is about the average age of entry.
We're going to continue on just a couple more questions in the effort of time, because I know we're coming up on 11:15. The question here, we regularly give monetary gifts to our children and grandchildren up to the limits set by the IRS. Do these stop because we move into independent living?
Yeah, great question. I'm glad you're asking it, because it's easier to deal with this issue today than later down the road. Your money is your money. You can do anything with it that you want. What a wonderful thing to be able to give those gifts to family members. Our issue is if you're in the position to be able to do that, that's wonderful. What a great legacy to pass on to your family. And what we're not saying is, no, you can't do that. What we're saying is, if you're giving away money and then expecting to receive charitable care from us, that's when it becomes a problem. So, and that's where it's different for everybody. So I just give you an illustration. If you've got $1 million and you're able to give away $20,000 a year to family members, and you're never really going to ever spend the $1 million, it's not an issue. Great, that's a wonderful thing. But if you, excuse me, over time, if you're down to $70,000 and you give away $20,000, then there's a little different story there, because the obvious answer is and especially if you're moving into higher levels of care, there's an issue there of really divestment, and that money's probably more important to you at that point in time. So I think to know your money is your money, you can do with it as you want. We will ask questions if you ask for support. We're more than happy to provide it. But if the gifts that you've given away is what's putting you in a position where you need the support, then it becomes problematic. From an estate planning perspective, it's a smart thing to do. Oftentimes is to give those things away. And many people will never need the benevolent services of Holland Home because they've got the resources to take care of themselves for as long as they live. So that's how we look at it.
Great. I'm going to ask this question, and I think there's a number of reasons. He frames this as the $64,000 question. Why should he choose Holland Home over one of our competitors?
That's a good question. Well, I can tell you, and I'll answer it personally. First of all, this is where I'm going to move in. It's where my parents and my in-laws have moved in. You're not going to find another senior living community in Michigan that has the breadth of services that Holland Home has, both in our facilities, in the services that are provided in the facilities, the quality of care that's provided if you need those higher levels of services. Our contracts are, I would say, the most cost-effective contracts that you'll find out there. So please compare them. I can tell you that there are some facilities that can't offer the medical deduction because of the way they amortize the refundable amount. So take a look at that. There's probably better deductibility on the Holland Home side for that. And we're fully transparent. We try to provide the greatest level of transparency we can for all of our residents about who we are and how we operate. When you talk about the mission of the organization and our commitment to excellence and following Christ's teaching in all we do, I can't speak for that for all of the competitors. We have very good competitors in the area, so there are good facilities. But I think when you compare our facilities, our vibrant care program, our memory care, the exceptional skilled nursing that's available, faith hospice, HRO home care, and I've worked for this organization for 35 years. There is nobody that's comparable to Holland Home in West Michigan. And I think you can pick spots that maybe somebody's a little bit better here and there, but when you look at the whole package, you can't find a better package in what you've got wrapped up in Holland Home.
Mm-hmm. I think, Dave, you said it well. I would have added to one of the reasons why I even work here, which is the mission statement, and the hundreds of people who come to work here every day who kind of live and breathe the mission statement, which is just that the pure commitment to excellence and serving with love and compassion. I mean, I can't tout our mission statement enough, and how much that just courses through our veins. And I'm sure other organizations would say the same, but I think our mission statement is absolutely beautiful. And that's why I chose to work at Holland Home 5 years ago. And that's why, I come to work every day, is because I think what we do is incredible. And I think the communities we have are amazing and kind of beyond reproach in a lot of ways. So beyond even all the financial reasons you just highlighted, which is weird for the CFO to even just say what I said. So.
And I would add, from the sales perspective, we work with a lot of former employees that choose to live at Holland Home. And if you think about that, I think that's a huge endorsement, because employees know, we're not a perfect place, but the employees know the warts and all. And we get a lot of former employees that choose to live here. I think that's a huge endorsement of what we do here, personally. Gents, do you want to answer a couple of these other questions, or do you want to? We can do that.
I can answer as many as they keep coming at us. I'm willing to spend as much time as you need to.
Okay. Yeah. So once in the CCA, I understand I cannot divest. However, are there limitations on my traveling or owning a winter home?
Yeah, so first of all, I want to say that you can divest. The issue is you can't divest and come and ask for help. So I want to make that clear. So your money is your money. You can do with it what you want to do with it. If you decide to give it all away with the expectation that Holland's going to take care of you at no cost, then you can't divest. But if you have the ability to divest, to give charitably, which, you know, we live in a community where charity is such a big part of what's going on, and you can do that, then good for you. That's a good thing to do. I think no, we don't really have limitations on traveling, owning another home, but I can tell you that at the time that you may be saying, hey, I'm having a tough time paying my bills, when we ask for that financial disclosure at that time, we're going to look at your assets and income. And so if you had a place at a warmer climate than what we have around here, and we're saying, hey, you have this asset that's worth something, we would look at that and say, hey, how do we deal with the fact that that you've got resources? They may not be liquid resources at that point in time. So it all comes down to what the particular situation is, and everybody's situation's a little bit different. So we have a number, there's probably a decent percentage of folks that choose not to live through Michigan winters and go to climates that are a little bit nicer. And hey, if you're able to do that, that's a wonderful thing. There's certainly nothing in our agreements that prevents you from doing that.
This question seemed very specific, and I don't know the details on it, but it says, if my brother were to move in with me and run out of money, then my money would have to cover his expenses as well as mine, right? And I'm assuming with this question that the brother and the sister, for the sake of the question, I don't know the details of the situation, but let's say for the sake of the question, David or Adam, that the brother and sister are both part of the continuing care agreement. That's my assumption.
Yeah, so we have single agreements, we have couple agreements. Couples don't necessarily have to be husband and wife. We've had situations where siblings have come in, and that's absolutely right. So whoever the members are of the agreement that sign as a couple, both members of the couple are fully responsible for the expenses and responsibilities and obligations of both members of the couple. So if one of the couple has needs higher levels of care, maybe has limited resources, then the other member of the couple would as a member of a couple's agreement is agreeing to cover those expenses. So any financial support, we would look at the assets and income of the couple in determining whether there was support available or not. We would look at both members of the couple.
Great.
And so in those situations, sometimes it might be better not to come in as a couple, but come in as singles. And then, we would evaluate a single agreement separately. But if it's a couple, it's based on the couple's resources.
Great. I am not seeing any other questions. So we really, and Wayne says, thank you for a wonderful and informative session. I think the level of questions indicates people were very interested in this topic. And we will be back. So first of all, thank you to David and Adam for taking your time. It was just a wonderful presentation. And I think I'm going to make both of you available. I know you've been open, like if people really have specific questions about this that you would welcome, we can facilitate that, a conversation with either one of you if they have some really deep dive questions about the continuing care agreement. Correct?
Yeah, we'd be happy.
Okay.
Absolutely.
Yeah.
Absolutely.
Yep. I just committed you on Zoom. So, yes. And so again, thank you for joining. And we will be back next month with a topic that's you'll be getting some information on it here shortly. And I hope you have a wonderful, wonderful rest of your day. And thanks for joining. Take care, everybody.
All right. Have a great day.